Denis Nash is a distinguished professor of epidemiology at the City University of New York Graduate School of Public Health. He joins us via Skype from Brooklyn in New York City. Thanks very much for being with us. How serious would you say is the third wave in Africa at the moment? What's the main driver behind it?
Well, I think it's very distressing. As you point out, the areas of the world where there's less vaccine is are also the same areas that are seeing, increases in cases and deaths. So it's highly distressing to me that there's so little vaccine coverage in the sub-Saharan African region. At the same time, not surprising because we've never really had a credible, coordinated global plan that enables us to deploy the vaccine at scale in areas of the world where it's most needed. As you point out, it's being deployed in resource-rich environments like the US and the UK and having an enormous impact there on controlling the spread of COVID-19. But vaccine coverage is now lowest in the areas of the world with the highest COVID-19 daily death rates, places like Namibia, South Africa, and Botswana, and Rwanda.
I mean, there was a COVAX set up, wasn't there, that was supposed to make a difference at the start of this pandemic, and there was talk of trying to kind of make it a more equal world with after the pandemic. What's gone wrong, do you think?
I mean, my sense is, while there's that lack of a coordinated global plan, COVAX is, a good idea in theory about, an equitable way to get vaccine across all areas of the world that might need it. It doesn't seem to be working in a pandemic where things can be changing, very rapidly from one day and 1 week to the next. What's important is getting vaccine to the right places at the right time with the most need, so that we can, really prevent the most number of deaths and hospitalizations.
And if you have a gap like that in vaccination rate across the world, how's that likely to affect the course of the pandemic?
Well, I think we're already seeing it in the maps. The virus is going to go to places of the world where there's lowest levels of coverage of immunity through natural infection or through vaccination. And so, unfortunately, what will happen is that the virus will continue to spread and we'll continue to see increases in deaths in some of these very vulnerable areas of the world. It also means that these places are going to have to endure the things that we are beginning to let go of in places like the UK, it will be very long before there'll be freedom days in other parts of the world that don't have access to vaccines. They'll be enduring lockdowns and non-pharmaceutical interventions for quite some time to come.
What do you make of the case rate in the UK? I mean, more specifically for England, the government has taken the view that the high vaccination rate has weakened the link sufficiently between infections and serious illness and death so that they can release some of these restrictions. But with a case rate around 40,000 at the moment, what do you think the risks attached to this are?
Yeah, I've been watching the UK very closely. The cases have surged, and we haven't seen a concomitant increase in the death rate yet in the UK. However, I've noticed that it's still low, but it's crept up and it increased about 4 or 5-fold over the last month. I do think that's a direct result of the increase in transmission that's happening with variants. I hope that the high coverage of vaccine can sustain such a surge in cases in unvaccinated people. It really gets down to how well the UK has done in getting enough vaccine to the most vulnerable people who are at greatest risk of hospitalization and death from COVID. And that, just brings me back to one point about the sub-Saharan African situation. It's home to more than 70% of people living with HIV in the world. And we've seen that people with HIV, especially with immunosuppression, are at very high risk for bad COVID outcomes and also can be infected with COVID much longer, resulting in the possibility of variants being even greater in such places. So we really need to figure out the best way and the fastest way to support our brothers and sisters on the continent in Africa through this horrible pandemic.
When it comes to the vaccines in Africa, do you think that the priority should be for healthcare workers? Because I was reading that WHO in Africa is concerned that actually they're not getting the vaccines and therefore then the healthcare system could collapse as well.
I do. I think that's absolutely right. The healthcare systems in sub-Saharan Africa are among the world's weakest. The healthcare workers per capita is quite low. You can't afford to lose any of them, or to have them not be coming in to do the work of caring for all of the sick patients. So healthcare workers especially need to be prioritized for vaccination there. And then there needs to be focused on distributing vaccine to the most vulnerable people outside of the healthcare system, including elderly people, people with comorbidities, people with HIV, which is a much bigger problem than it is here. And there's also really challenging issues related to the ability to do surveillance for the virus, and the laboratory testing infrastructure is often weak, making it hard to know where the virus is spreading and among whom. So that helps hobble the public health response to the pandemic there.
Denis Nash, thank you very much indeed for talking to us on Al Jazeera.
Thanks for having me.